Today I wanted to talk to you guys about risk of getting blood clots while you are using hormonal birth control. The birth control I'm talking about is a combined hormone, which is estrogen and progesterone both together. So it could be in the form of birth control pills, a patch, or even a contraceptive ring. Now, there are so many social media posts about your risk of getting a blood clot that I thought I should really talk about this in a little bit of details with you. What are blood clots? Blood clots are like this semi-solid gel-like material or clots which can circulate in your bloodstream. They are usually in your veins of the legs, and from the leg they can go to your heart, your brain, or your lungs. So they are scary, but there are women who have a little increased risk of getting these blood clots whether they are on the hormones or not. So for any woman to get a blood clot, the risk is about 1 to 5 per 10,000 women. When you use the combined hormones in a birth control, the risk can get as high as 3 to 9. So not crazy high, but yes, it is high, 3 to 9 in 10,000. But guess what? This risk can get as high as 20 in 10,000 women if you are pregnant. And the first 3 months postpartum, right after the baby, that could be as high as 40 to 45 per 10,000 women. So you see, yes, it increases your risk while you are on a combined hormones, but it's not as high as when you're pregnant or you're postpartum. So remember this before you completely stop your birth control pills or patch or a ring. Do not get pregnant unless you really want to. Now, to get on the birth control, I would definitely want you to be seen first by your gynecologist or your primary care doctor to see if you are a right candidate for it. Do you have a risk factor? And what are the risk factors? Smoking increases the risk of blood clots. Obesity increases the risk of blood clots. If you have a family history of clotting disorders, if you have other members in the family who got clots, then you need to be checked for certain deficiencies like protein S and factor V Leiden. So get checked for that. Make sure that you are not at a risk, and after you start, make sure you get a good follow-up so they can check and make sure that you are not getting clots or you are not increasing your risk of getting clots. Now, after all this, if you are still worried about getting clots while you are using a combined hormone, then you have other options. There are non-hormonal birth control options like a copper IUD, sterilization, condoms, spermicide, and vaginal gel. So there are a lot of choices, and I think instead of just stopping the birth control because you saw the social media post, it will be a good idea to make the informed decision after talking to your gynecologist.